歡迎各位。
Welcome to the press briefing on the updates of COVID-19 cases. We have with us today the Secretary for Food and Health, Professor Sophia Chen, Permanent Secretary for Transport and Housing, Ms. Mabel Chen, Director of Health, Dr. Ronald Lam, Controller of the Center for Health Protection, Dr. Edwin Choi, Head of the Communicable Disease Branch of the CHP, Dr. Cheong Chuk Kwan, Chief Executive of the Housing Hospital Authority, Dr. Tony Ko, and Chief Manager of the Hospital Authority, Dr. Larry Lee. Professor Sophia Chen will first say a few words, and then the other doctors will give you an update on the latest cases. Professor Chen. Good afternoon, friends of the media and members of the public. This is New Year's Eve. I would first like to wish you all the best of health in the new year. But of course, we must not forget about fighting the virus. We must remain highly vigilant and work together to keep out the virus. Now, together with colleagues of the Transport and Housing Bureau, the Department of Health, and the Center for Health Protection, as well as the Health Authority, we're here to update you on the latest situation and also to answer your questions. Omicron, this variant strain, is now raging in the world. It's coming. It's an onslaught on the world. As you might recall, I chaired a meeting before Christmas. The Center for Health Protection and the Hospital Authority are now fully prepared to respond to any latest development. If there is fifth wave of infection and if there is community outbreak, we will have already put in place a contingency plan to respond to that. In the past week, I have inspected the various quarantine and other measures. Then these include the beds, hospital beds at Hospital Authority, the isolation facilities, the North Lantau Infection Control Center, as well as the Penny Bay's Quarantine Center. I've received reports from colleagues on the latest situation involving these facilities, and if there should be a fifth wave of outbreak in the community, so we know what we need to do in response. Now, in recent days, there are 4 aircrew members from the same airliner who've become confirmed cases. One of the confirmed patients patronized a local restaurant on the 27th of December in the afternoon. That is the Moon Palace at the Festival Walk. Now, he passed the virus to his father, who was at the same table, and another customer who was eating seated about 10 meters away in the same restaurant. So this is the first time we found local infection case involving the Omicron variant strain. It shows that there are now imported cases that found a way into the community, leading to a cluster of infections. Of course, this latest development is extremely worrying. Now, when cases like this happen, the Department of Health, the Center for Health Protection, and the entire team immediately responded to the situation. We put in place various measures, for example, compulsory testing, restriction and testing, notices, and so we have conducted compulsory testing on many people, and we are now tracking close contacts. In a moment, the Department of Health colleagues will be giving you more information on such actions. This morning, the Chief Executive invited the Chairman of the Cathay Pacific and the Chief Executive of the Cathay Pacific to meet with her. She conveyed her grave concerns to them about this violation of the requirement of 3 days of home quarantine by the aircrew members. She expressed strong dissatisfaction to the flouting of the rule. In the past few days, there were Cathay Pacific aircrew members who flouted the rule upon return to Hong Kong. They actually went to crowded places and increased the risk of local infection. They were being irresponsible. So a large number of residents have to be sent to quarantine centers or have to take repeated tests during the New Year holidays. The chief executive made it clear that she would not accept any such violation of the rules. She has demanded the chairman of the Cathay Pacific to conduct a review in person on the cases and to give the public a satisfactory explanation. The Transport and Housing Bureau has also released a press release to further tighten the quarantine arrangement for local crew members. Now, for those who've been to overseas places or Taiwan, instead of having to stay in designated quarantine hotels for 3 days, they have to stay at such hotels for 7 days until they receive a negative PCR test result. And this arrangement will take place from tomorrow midnight, that is the 1st of January 2022 midnight. The chief executive has also made it reiterated that we want to maintain the economic vibrancy of Hong Kong and to protect public health. So we need to make sure that air cargo services plying between Hong Kong and other places could also remain in normal operation. This is to meet our day-to-day necessities. The SA government, under the current circumstance, will first deal with the latest development in the epidemic situation. Of course, we will keep to our strategy of keeping out imported cases and preventing local outbreaks so that we could create the favorable condition for the resumption of quarantine-free cross-boundary travel. At the same time, we're going to step up a series of measures. Just now I mentioned the press release issued by the Transport and Housing Bureau. And then in Hong Kong, we need to strengthen the immune barrier against Omicron. So the government will further expand the scope of the vaccine bubble. First of all, before the Chinese New Year, for premises such as eating establishments and scheduled premises regulated by CAP 599F, we plan to impose the requirement that for those entering these premises, they have to receive at least 1 dose of vaccine. So that's what we plan to do. And these premises include public entertainment venues such as cinemas, fitness centers, beauty parlors, sports stadia, libraries, museums, and theaters, and other government leisure and cultural services venues. And then for staff at these premises, they have to complete vaccination before designated day, except for those who could not receive the vaccine due to age or other reasons certified by doctors. And we found that Omicrons have already found a way into the local community. So in the next 2 weeks, this is a crucial period for us to keep out Omicron. This is really critical. So I would like to make a solemn appeal to the public that we must all do our part and join hands to fight this virus. Together, we must stop the 5th wave of outbreak in Hong Kong. So I would like to make 4 appeals to the public. First, please pay close attention to announcements of the government and the media on places that require compulsory testing, and people should then take the test regularly as scheduled. For us to deal with the infected cases, the Center for Health Protection is now actively tracking close contacts. And they're also trying to contact customers who were at the restaurant during the same period, so that we could take early measures to do tests and make quarantine arrangement and prevent the spread of the disease. Now, many have been informed and have been contacted, and some have been put into quarantine. We've also announced places where the confirmed cases have been to during the past period. So we require those who were at the same places during the same period to take compulsory tests. In a moment, the Center for Health Protection will explain the testing arrangement to you, because people will have to take repeated tests. So they'll be giving you the details later. If I may also report to you, in the past few days, on average, there are over 40,000 people who took the test through various channels. And in the past few days, close to 20,000 people have received the notices on infection risk through the Leave Home Safe app. They went to mobile testing spots to receive free tests. This is a record high. The second point, if you and your family members have not yet taken the vaccine, please protect yourselves and take the vaccine as soon as possible. Now, if you have already taken the first and second doses, please also take the first dose as soon as possible, where permitted. Now, the government has already announced that starting from tomorrow, that is the 1st of January 2022, we will expand the vaccination program. There are 10 community vaccination centers. For 9 centers, they will be extending their opening hours to facilitate the taking of the third dose of vaccine. Now, for those who have taken 2 doses, who are eligible for the third dose, and then for young people between the age of 12 and 17 to take the second dose of BioNTech. So there is this new arrangement for the community vaccination centers. Now, according to the WHO's recommendation, that it is, the Omicron could lead to complications and fatal cases. That's why I must appeal again to the high-risk groups such as the elderly, the chronically ill, those with weak immune system, to protect themselves and the public and take the vaccine as soon as possible.
The
third point, do avoid going to crowded places or participate in gatherings without mask. Like I said, the 4 cases we have identified, we are tracing the close contacts of those cases. We don't want to see more cases, but it is very likely. The coming few days or coming 2 weeks will be crucial. We will be having holidays, so I appeal to the public to avoid crowded places. Now, this is a festive occasion. That's exactly why we have to appeal to the public to avoid participating in high-risk, large-scale activities, especially for those who are subject to compulsory testing. If you have received a notification, please be extremely vigilant in order that you do not affect your family members and friends unintentionally during gatherings. For such social gatherings, especially if it is a meal, mask will be taken off, so we have to be extremely careful. I have noticed that many members of the public would take off your mask to take a group photo, and I strongly urge you against that. The 4th point, maintain personal hygiene, keep your mask on, wash your hands, and pay attention to your health. If you have any symptoms, no matter how mild it is, you should seek medical assistance, get tested, and stop participating in any gatherings. Later on, the CHP colleagues would tell you about places where confirmed cases have been to. Those people who have been to these places should be very careful and get tested. In view of the imminent surge of the Omicron strain, the SAR governments will maintain high vigilance. The FHB, the Department of Health, and the hospital authority are already preparing for a possible 5th wave in terms of response measures, testing capacities, quarantine facilities, and tracing capacity. We are prepared to activate response measures in short notice, including testing, quarantine, isolation, treatments, and social distancing. Now we are going to have the new year. I strongly urge the public to keep keep being vigilant and maintain social distancing and personal hygiene. Keep your mask on and maintain hand hygiene. Please be vigilant about the latest developments of the pandemic, and please pay close attention to premises where confirmed cases have been to. Only with your cooperation can we minimize the impacts of the virus for Hong Kong. We have to fight the epidemic together and be alert. Thank you.
Mr. Lam, good afternoon. The Center for Health Protection of the Department of Health is now conducting investigation into a restaurant where there's a spread of the COVID-19 cases. In a moment, Mr. Choi and Dr. Chuang will give you more information about the investigation findings. As the Secretary pointed out just now, since the fourth wave of outbreak, this is the first time in Hong Kong where we have seen confirmed cases involving the Omicron variant strain. So we want to do our best to prevent the spread of the disease in the community. I'd like to report to you what the current situation and the risk assessment. Now, we see three risks there. First, on the pressure of importation of cases into Hong Kong. Now, around the world, there have been 5 million new cases in the past week. For the Omicron cases, they are being spread around the world in unprecedented speed. It's now spread to at least 110 countries. Now, from the information we have kept for preventing importation of Omicron cases as at the 30th of December, there are recorded 81 confirmed cases involving the Omicron variant strain in Hong Kong. As for cases that are highly suspected to involve Omicron, that means cases that carry the N501Y and 78K cases, well, that we have not completed the genetic sequencing, but these are highly suspected cases, and there are 28 in total. The Center for Health Protection mentioned before that in the past 2 weeks, or 2 weeks ago, Omicron accounted for about 35% of the total number of infected cases, but as at yesterday, it exceeded 90%. So we could see, therefore, we will be seeing increasing pressure in our strive to prevent the importation of cases involving Omicron. That's the first risk we see. The second risk we can see is that there are several features involving Omicrons that makes Omicron more threatening than the Delta strain. First, it's highly transmissible. It's more transmissible than the Delta strain by 4 to 8 times. And then some may have been infected with the COVID-19 virus before, and for these who have recovered, they could be reinfected by Omicron. In the UK, the data shows that in about 100 recovered patients, 10 would be reinfected with Omicron. So for these 100 recovered cases, they may have been infected by Delta or Alpha, and 10 of them could be infected by Omicron. And then I mentioned there are 81 Omicron cases in Hong Kong. The majority of them, over 60%, were asymptomatic when the cases were confirmed. So if the cases are asymptomatic, of course, it will be easy for them to go into the community without detection. That's the third point, the third feature. The fourth feature of Omicron is that because it's a variant strain, so relatively speaking, the effectiveness of vaccine is less for the Omicron strain. So taking all these four factors, that lead us to the third risk, which is very important. In terms of the vaccination rate in Hong Kong, it is actually a gap that a loophole in our prevention against Omicron. Only 30% or about 30% of the population have not been vaccinated at all, especially for the elderly, aged 80 or above. It's just some 20% of those aged 80 above have taken the vaccine. So that's why this is a serious loophole. Now, for we have COVID-19 vaccines, BioNTech and Sinovac. Even though they are less effective for Omicron, but still they could effectively reduce this gravity of the condition if vaccinated individuals are infected with Omicron. That's why it's important for people to take the vaccine. And also the scientific committee and the expert advisory panel have suggested that it's found if we take the third dose of the vaccine, that could help to boost the overall immunity. So with the third dose of vaccine, we could reduce the risk of infection as well as reduce the risk of fatality. That's why we appeal to those aged 18 to take the vaccine as soon as possible. If you've already taken those 2 doses, please take the third dose as soon as possible. Just now, the secretary mentioned that there's been Omicron cases at the restaurant. So we are so at the brink of a possible 5th wave of infection. So of course we will do our job to try to prevent that from happening, but we also rely on the public to work with us. So we have to keep reminding the public to take vaccination as soon as possible. And during the New Year and the Chinese New Year holiday, they may still travel abroad even with the quarantine requirement. But we would like to appeal to the public to avoid unnecessary travel. And if you do have to travel, please take the vaccines first. And before you travel, of course, you must make sure you bring with you enough masks, and you have to observe personal hygiene. And parents should avoid bringing young children who could not be vaccinated on overseas trips or travel. And then again, we must remind the public again to take the vaccine as soon as possible, and also please wash your hands frequently, observe personal hygiene in our effort to keep out the virus. Dr. Ko.
Good afternoon. From what the Secretary and the Director of Health said, you must be aware that we have a high risk of spread of Omicron in the community. From overseas experience, we can see that once we have community outbreak of Omicron strain, the number can surge explosively. In foreign countries, we are already seeing exponential increase. The severity and the speed of spread can increase dramatically, so we have to be well prepared. The Secretary mentioned that we have reviewed our quarantine measures because of the severity of the situation internally. The hospital authority has reviewed, has taken stock of our manpower and our resources. And also we have once again reminded our colleagues in the A&E departments as well as the general outpatient clinics to be alert against possible cases. One of the cases yesterday has been to the Tuen Mun A&E department. We will arrange for quarantine and testing and treatment for patients, and also colleagues working in the A&E departments will have to undergo regular testing so that we can identify possible cases. We have also reminded our colleagues to pay additional attention to patients' travel history, occupation, and whether they might have contacted possible patients. This is something called the FTOCC. If the patient is within this category, we would remind the colleague to take proper prevention measures and don PPE and give the patient a test. We urge members of the public, if you have any symptoms, if you have displayed, if you fall into the category I've mentioned just now, please alert the medical staff so that they can be prepared. So far, all confirmed patients are being treated in the North Lantau Infection Control Center and the Princess Margaret Hospital. So far, some 180 patients are being treated. With possible local cases, we may see a speedy surge of cases. That's why we have decided to reactivate the Asia World Expo treatment facility. Depending on the developments of the epidemic, on the 2nd of January, at the soonest, we would reactivate the AWE facility to receive patients with mild to or even no symptoms who are required to undergo quarantine. For the first phase, we will activate 500 beds to receive these patients. Depending on the situation, we may activate beds in batches. Previously, we have activated some 1,200 first-tier beds in our clusters, and also we have 600 second-tier beds. In terms of manpower, we have arranged colleagues to conduct drills and practices in the AWE, and we have arranged for spare manpower for that purpose. Earlier on, we have procured enough PPE for our colleagues. Our PPE can last 6 months' uses, and we have enough medicines and ventilators, more than 1,000 of them, for more serious patients. Here, I would like to appeal to the public again. If you haven't been vaccinated, please get vaccinated soon. From journals and experience overseas, vaccination can effectively minimize the possibility of serious complications. We haven't have an outbreak yet, so it is very important to get vaccinated before it happens. Thank you. So Dr. Chong would tell us the latest situation.
Good afternoon. There are 19 confirmed cases, number 126372 to 12655. We have another 16 preliminary positive cases. Among the 19 confirmed cases, they involve 10 male and 9 females aged between 13 and 76. All carry the N501Y variant strain. Apart from one, all the other confirmed patients also carry the T478K variant strain. For the remaining case, we're still trying to test the strain. So all cases are suspected Omicron cases, and all have been vaccinated. 4 of them have actually taken 3 doses of vaccine. Among the 19 cases, 17 are imported cases. Among the 17 imported cases, 6 are arrivals from the U.S., 2 were detected upon arrival, 4 were identified during their stay at Penny Bay the following day. This cases 12638, 12639, 12640, 12650, and 12651. And that's another case, an arrival from the UK. The case was detected from the second day sample. That's case number 12641. And there's another case who've been to both the UK and the US. That's case 12652, detected upon arrival. There are 5 cases from the Philippines. These are foreign domestic helpers. They were all detected at the airport. They took Flight 5J272 and arrived at Hong Kong on the 27th of 12. All 3 cases were identified during their stay in Penny's Bay. They were not friends. And then there are another 3 cases coming from Canada. 1 case was detected. 2 cases were detected at airport. 1 case was detected on the 3rd day of arrival. That's a case 12647, 12653, and 12655. And among these 3 cases, and also there's 1 case, 12649 that was mentioned earlier. This is a pilot of an air cargo plane. On the 25th of December, he was on the same flight, CX843, with case 12610 to arrive at Hong Kong. He is pilot of a cargo plane. He lives at Hoito building. The building was subjected to restriction testing notice last night. 208 residents were tested. The results were all negative. Now, this pilot has taken 3 doses of vaccine. His last duty flight was on the 22nd of December. He flew CX840 to New York. Before he left Hong Kong on the 20th of December, he took a test. The result was negative. In New York, he stayed at the hotel. And then when he came back on the same flight with 7 others. That included case 12610. On the 25th of December, arrived at Hong Kong. He took a test. The result was negative. And then he went home. On the 27th of December, he took another test at Shek Tong Tsui. Again, the result was negative. Now, because he's a close contact case 12610, so on the 28th of December, he was sent to the Penny's Bay Quarantine Center, because it's a close contact, as I mentioned. On the 29th of December, after he's gone into the quarantine center, he took a test. The result was positive, and then they're both strains, the N501Y and the T478K. And he is asymptomatic all the way, and now he's been sent to hospital. And then between he was sent to Penny's Bay, he stayed at home on the 25th and the 26th of December. On the 27th, he went to Shek Tong Tsui to take a test in the morning. And then in the evening, he went with 2 friends to a pizza place, Pizzi, at Soho. He went there for dinner with 2 friends, and later on, he went to the Soho House in Sheung Wan. That's a club. He went with 2 friends there, and even later, after 10 p.m., he went to the Iron Ferries at the China Camp Hollywood Central. It's a bar, and he stayed there till late in the evening. He went with 2 friends all the way, so these 2 friends have been sent into the quarantine centers. Now, apart from these import cases, there are 2 cases related to import cases, but they are classified as local infection cases. On the 27th of December, these 2 dined at Moon Palace. The first case is 12637. That's the family member of case number 12611. He and his family members lived at Wing Chek House of Chekon Estate. Now, the building was blocked for compulsory testing last night. Some 900 residents took the test. The result were all negative. Now, this patient has taken 2 doses of vaccine, and in the past few days, he did not any spend time with 12611. The only occasion they met was on the 27th of December in the afternoon, together with 126. He and his friends, together with 12611, met up, and then they went to the Apple store in the Festival Walk to collect a phone. And then later on, they had a meal at the Moon Palace from around 1:30 p.m. to 3 p.m. So that's the only occasion when he had contact with case 12611 in the past few days. After the meal, he learned that 12611 became a confirmed case. So the following day, he went to the Pectin testing center for tests. The test sample came back negative at the time, and then he went to the ancillaries block, the Fairwood fast food place in Shekip May, and then for lunch, and then later on he went to the Japan home in Namcheong to do some shopping. After that, he took public transport to go home. On the 28th of December, he was sent to the quarantine center. On the 29th of December, a sample was collected from him, and then the sample tested positive for N501Y and the T478K. Now, his friend is so far tested negative. There's another customer at the Moon Palace. It's case number 12654. He's a 34-year-old scaffolding worker. He lives with his family members at Tuen Chi Wai in Tuen Mun. This is village housing. So for residents who live in the same block have been asked to take the test. He's taken 2 doses of vaccine. On the 27th, he went with 3 family members to go to Moon Palace for lunch from about 2:30 p.m. to 4 p.m. His table is actually quite a few tables away from the 12611, about 10 meters away. And after lunch, or during lunch, he did not leave the table. And after lunch, he went to the convention and exhibition center and exhibition gallery. He also went to the Tuen Mun, the Kyokaku Japanese restaurant in V-City Tuen Mun. On the 28th of December, he took a test. The result was negative. And then he went to Broadway Theatre to see a movie at the Metro Plaza Kwai Fong. He went to the 7:30 screening. The film was Spider-Man. He watched the film at House 3. On the 29th of December, after work, he went with friends to go to Commune 10 at Tuen Mun Ming Ai Street for meal, for dinner. And then starting from the 29th of December, he started to have cough, and then on the 30th of December, he started to have fever, so he went to the accident emergency ward at the Tuen Mun Hospital. Sample was collected, and it tested positive for N501Y and T478K. Now, after the meal at Moon Palace, he went to work on the 28th and the 29th of December. Usually, he would work at a small construction site, working with 2 other colleagues to put up scaffolding. These 2 colleagues will be sent to the quarantine center. And then on the 28th and the 29th of December, he went to some units in Manshan, for scaffolding work. He also went to Tai Po, Sun Fung Garden. Apart from these 3 cases, these 19 confirmed cases I mentioned, there are 16 preliminary positive cases. For one of the positive preliminary positive cases that involves staff member at the airport. She's a 30-year-old lady. She works in the restricted area to take transit passengers to their flights, and she would help to collect boarding passes. Now, usually her hours are from 10:30 a.m. to 10:30 p.m. She went to work today, but now we've sent her to the hospital because she's involved in high-risk work, so she does take tests regularly. The last few tests she took were on the 25th and the 28th, and both test results were negative. On the 28th, she had a minor cough, so she went to see a doctor at the Tin Chak shopping mall. And then she took a test too, and the result was negative. And then on the 30th, when she took another test, the result became positive. It's a preliminary positive case. I understand for this case, there's also the N501Y and the T478K strains. Now, since the 28th of December, she's been going between work and home. She also went to some eating establishments. For example, on the 30th of December, she went to the Little Bangkok food station in Causeway Bay. And 29th, she went to Canteen, and then on the 24th and 28th of December, she went somewhere in Tin Chang, and then on the 25th of December, again, he went to the Serena restaurant at Tin Chang. So she had meals either with family members or friends. So that's all by way of report from me. Thank you.
Will Dr. Lee please tell us about the patients under hospital authorities' care? Good afternoon. As at 9 a.m. this morning, in the past 24 hours, we have reported 30 cases. We also have 10 confirmed patients who have been discharged. As at 9 a.m. this morning, among our 176 confirmed patients in the North Lantau Infection Control Center and the CHP facility, 175 are stable. 1 is serious. The number of our ward and beds, the number of our beds is 1,109. Utilization rates 56.7%. Negative pressure purpose 26.1. Non-negative pressure purpose 36.6. Negative pressure ward 632. Utilization rate 66.8%. Non-negative pressure purpose 36.6, non-negative pressure purpose 30.2%. I urge you to get vaccinated. More than 96% of our colleagues have been vaccinated. Now they are starting to get the third jab. We urge all members of the public to get jabbed as well. We would like to remind the public as well to stay vigilant during the New Year holidays and maintain social distancing. Thank you. Now we will take questions. Please use our microphones and please limit your questions to 3 and identify your media organization before you speak. The gentleman over there. Good afternoon, RTHK. Dr. Zhuang, about the Moon Palace case. They are 10 meters away and the other patient has not left the table. So what is the transmission route? And about CX, the Cathay airline, there are rules flouting. So what is the company doing to in response? And will there be any punishment? And you said that the next 2 weeks will be crucial. Tonight we are going to have the countdown, and we are going to have a major music concerts and music award presentation ceremony. So would you request these activities to be called off? The secretaries and the CE mentioned about a resumption of cross-border travel. Now this is a crucial period, so would you be pessimistic about this? We have the incubation period as well, so are we looking at reopening of border after the Chinese New Year? Dr. Zhang, thank you for your questions. About Moon Palace, we are very concerned. The other patient was not just at the table next to the patient. So last night, together with the EMSD colleagues, we paid a visit to the restaurants. The air exchange is uneven. For some tables, the situation is worse, maybe 2 air exchange per hour. That's why we are concerned. During the entire period when 12611 and his father had meal, we are tracking down all the diners during that period. For staff members of the restaurant, some 22 of them who work in the period, they have been sent to quarantine. There are a score of tables there. So we are talking about some 200 customers who need to undergo testing. If you have been to Moon Palace during that period, please call us 2125 1111, 2125 1111, or 2125 1122, so that we can investigate your case. So far, we have identified some 10 customers. Some of them left their telephone numbers, but it is more difficult to find the others. We have also collected some 40 samples. Results will be available soon. Secretary, please. On your question about Cathay's response to the possible flouting of post-arrival home isolation rules upon arrival at Hong Kong, like I said this morning, the chief executive has met with the chairman and the chief executive of Cathay and expressed her concerns and strong dissatisfaction about the flouting of rules. We have laid down rules according to Prevention and Control of Disease Ordinance S15. If they have contravened their medical surveillance conditions, including home isolation and self-isolation requirements, they would be subject to a maximum of $5,000 fine and 6 months imprisonment. The point is, if these requirements have been contravened, then, like the chief executive said, it is totally unacceptable. The chief executive has directed the chairman of Cathay to review the incidents personally and give a satisfactory account to the public. Concerning major events, I appeal to the public, try to avoid these events as much as possible, and avoid places which are crowded, and avoid gatherings without masks. For large-scale activities or mega events, or simply going to shopping malls, do avoid these as well. For major events, if public entertainment permit has been issued, then there would be infection control requirements implemented. So we would also urge the organizers to adhere strictly to the requirements under the permit. Mask wearing is a key. Like I mentioned, I have noticed that many people would take their mask off when taking photographs. Don't do that. Keep your mask on. And also for banquets, we should avoid toasting. And about resumption of cross-border travel, bureaus and departments are preparing for resumption of cross-boundary travel. Of course, the priority is to handle the pandemic properly. We will adopt the most stringent measures to guard against local infections and importation of cases to achieve dynamic zero infection of cases, which means that we may have cases, but we will implement the highest level of measures to stop it from spreading and create favorable conditions.
The lady of long hair in white. I'm from Cable TV News. If I may follow up on an earlier question, now if there are major events, you're saying people should avoid these events as far as possible. In that case, why wouldn't the government consider cancelling these events or banning these events? For the Moon Palace place, are there further preliminary positive cases involving Moon Palace? And then for cargo crew members, we've been talking about quarantine for 7 days, but all along it's been just 3 days. And now you are changing that to 7 days. Wouldn't you think it's too late? Can I ask the professor to take the first and the third question? Dr. Chuang could take the question about Moon Palace. Well, as I said earlier, we have to work on several fronts. One, for the organizers of the events, they must follow very strictly our requirements. and about, say, the admission of people, and then there's a need for people to do tests or be vaccinated. So all these requirements must be strictly followed. And of course, there is need to scan the Leave Home Safe app. Use the Leave Home Safe app. And then second point, we would like to appeal to the public to avoid going to crowded places as far as possible. And they should also try to avoid gatherings at where masks may be taken off. For Moon Palace, I will ask the Department of Health to answer that question. On the Cathay Pacific air crew, the Transport and Housing Bureau issued a press release earlier. It's announced that there will be further tightening of the quarantine arrangement for aircrew members in Hong Kong. The quarantine period will be extended from 3 days to 7 days. Permanent Secretary, anything to add, please? Yes, for cargo crew members quarantine arrangement in Hong Kong. Now, I must stress that air cargo activities are important to meet our daily necessities in Hong Kong. So while we try to ensure to protect public health, we must also make sure that there is smooth functioning of air cargo activities. This is to make sure that we could meet the daily necessities of the public. At the same time, there is a need for medical and other emergency supplies. And then we will, from time to time, review the quarantine arrangement for air crew members. Earlier, we made the announcement that for air cargo crew members, they must stay in designated quarantine hotels for 3 days upon arrival in Hong Kong. And on the third day, if they test negative, using the nucleic acid test, then they could go into the community. But in light of the latest epidemic development, and in the light of cases involving aircrew members, so just now we have issued a press release to further tighten the quarantine arrangement involving aircrew members in Hong Kong. For those who've been to overseas places or who've stayed at Taiwan, now they have to stay at a designated quarantine hotels for 3 days. And starting from midnight, the 1st of January 2022, when they return to Hong Kong, they must stay at a designated quarantine hotel until they receive a negative PCR test result on the 7th day. And after they leave the quarantine hotel, they must still receive repeated and periodic PCR test in the next 14 days of medical surveillance. This is for us to monitor the situation. The THP has been enclosed this liaison with the airliner. So we want to make sure that we would protect public health. At the same time, we need to make sure there is adequate supply of goods to Hong Kong. So we need to strike a proper balance. We'll continue to monitor the situation closely. We'll keep in close cooperation with the airline companies, and so we could minimize any possible impact with our new quarantine arrangement. Mr. Wong, please. Or Dr. Choi. Now, you asked about a cluster infection involving a restaurant, so we want to know what we're doing now. We believe actually that virus has been in the restaurant, otherwise they wouldn't have been the infection cases. Now we know Omicron is highly infectious, so what we need to do now is to identify all customers who were at the restaurant at the time. We need to do a test for them as soon as possible to confirm that they have not been infected. So that's our very top priority. So are there any means for us to find these people as soon as possible? As Dr. Chuang pointed out, now when they say made a booking, they left a phone number, so we have contacted those customers on with these phone numbers. And then the next thing we can do is to issue a compulsory testing notice. Now, Omicron has already appeared in the community. That's why we need to step up the compulsory testing arrangement. So when there are cases at a certain venue, hopefully then we could trace customers or the general members of the public that have come into contact with the confirmed case, so that we could achieve early detection, early isolation, and early treatment. Now, for Omicron patients who've been to the workplace or other places in Hong Kong, for people there in St. Philip, they must take at least 7 tests. So the first test is on the day of detection, and then on the 2nd, 3rd, 4th, 7th, 12th, and 19th day, there must also be tests. So for cases that have been to different venues, we would issue compulsory testing notices, and we would also state clearly the dates for taking the test. We hope the public will pay attention to these notices. Dr. Chong mentioned many locations. It's now shown here on the screen. So please pay attention to government notices. And we hope members of the media would also help us spread the words to the public. Now, members of the public could also rely on notification on the Leave Home Safe app, or you could use other channels to check whether we've been to these high-risk places. If members of the public are not sure whether they were at the same place during those particular periods, I would suggest that they take a test as soon as possible so they could get assurance. And this is also prevent them from spreading suspected cases to family members. Now, we want to protect public health, so perhaps members of the public may have to take repeated tests over a certain period of time. We know this would cause inconvenience to the public, but we hope you would appreciate that we are now in a critical stage because we have seen local cases in the community. So please follow the compulsory testing notice and take all the required tests. And if there are others who do not take the test, the required test, we will take these cases very seriously. We want to make sure everyone complies with the notice. Now, you see, here we have listed 9 locations and 2 bus routes. Dr. Trong mentioned a case, and that case went to these places or took these buses during the highly transmissible period. That is from the time we detected the case until the time the patient was isolated. And in these places, he would have taken off his mask to eat, or maybe they would be in the same space with customers for a prolonged period, such as in a cinema or on a bus. And we believe for these situations, the risk would be high. So we have also given you a date for these possible high-risk contact. That's why we want to inform the public as soon as possible. Now, for Moon Palace in the Festival Walk on the 27th of December, if during the lunch hour you went there for a meal, or maybe you were not sure of the actual time when you were at the restaurant, please take a test as soon as possible. Thank you. If I may add, just now Dr. Choi mentioned taking tests in a timely manner. This is very important, and we're talking here about compulsory tests. So we make sure we have enough testing capacity on the part of the government, so that for the need for compulsory testing arising from these cases, then people could take the test. And also, if you're not sure and if you're worried, please do take the test. Maybe at different buildings or other locations, we have actually set up over 10 temporary testing stations. For example, today and tomorrow at Festival Walk, we will set up sample collection station. And you know that there are also community testing centers across the territory. There are 19 such community testing centers, and then we also have 10 mobile testing stations. So today, across the territory, there are over 40 locations where there are either community testing centers or mobile testing stations, and people could take free tests there as necessary. And each day, we could serve some 60,000 people. Of course, we will continue to monitor the testing capacity of these various facilities, and if necessary, we may consider adding more temporary testing stations to facilitate the public.
Next question, please. Hi, I'm from Singtao Daily. 3 questions. The doctors mentioned that we are seeing a community outbreak and the situation is critical. Will the government consider further tightening measures, including what we had during the 4th wave? For example, dining ban at night and limiting the number of persons at the same table. Will we see these restrictions again? About quarantine for aircrew members. Many experts have advised that we should strengthen and tighten the quarantine days from 3 to 7. It seems that the measure is quite has been tightened quite quickly, and the airline companies will have a hard time catching up. So, is it too quick? And also, there are reports that further tightening the quarantine measures would limit the capacity of air cargo delivery. So, by further tightening the quarantine measures today, will it further affect the capacity of air cargo delivery, and how can you assist the airlines? About vaccine bubble, the Secretary mentioned that you will study implementing the bubble before the Chinese New Year. Well, time is rather short, and we still have 30% of the population who are yet to receive the first jab. So can we catch up in such a short time? And now we have only 10 community vaccination centers. Can we vaccinate the remaining 30% of the population in such a short period of time? And what about those who are not fit for vaccination? Will there be exemption for them? Well, there are quite a number of questions. Thank you. And will there be penalty for those who can't get vaccinated in the future? Secretary would answer the first 2 questions, and then the Permanent Secretary would answer the question about cargo flights. On the first question, the government is fighting against the epidemic with full force. There are 3 points. Now we have identified community transmission in a restaurant. Of course, we will continue to trace the spread of the virus to identify possible patients. In terms of testing and vaccination, that's where we have to work together. No matter how much effort the CHP is putting into tracing the cases, we have to have the cooperation from the public to come out and get tested. We have seen cases where patients were tested negative in the first test and then positive in the second test. For those who have not received a jab, please get vaccinated. Like I said, starting tomorrow, we will further expand the vaccination program. At our community vaccination centers will have their operating hours extended. And there are other measures to facilitate vaccination. For example, we will have mobile vaccination stations. These efforts are ongoing. The most important thing is the members of the public should come out and get vaccinated. The CHP, the hospital authority, will closely monitor the capacity of our facilities. We will get prepared. On this front, we are already prepared. Besides the tightening of measures, of course, we have been adopting the highest level of prevention against importation measures as possible. There are measures before boarding flights. We have closed-loop management during hotel quarantine. So these are the high standards we have been adhering to. Every day we have a press release notifying the public about the spread of Omicron globally. Places with outbreak would be included under Group A. Number of visitors number of travelers from these countries would be limited. About social distancing measures, that is another matter. First, we are going to extend the vaccine bubble to scheduled premises. These premises, of course, include high-risk places like restaurants, entertainment venues, cinemas, gyms, beauty parlors, and so on. Whether there would be exemptions, our plan is everyone except for two groups, that is those who are ineligible to get vaccinated because of age, and those who hold a medical certificate proving that he or she is ineligible to get vaccinated. Otherwise, everyone has to be vaccinated to go to those venues. The government will make sure that there are enough doses for everyone. Besides community vaccination centers, our partners in the private sector will also participate in the program. About social distancing measures, at this stage, we will closely monitor the situation. The Food and Environmental Hygiene Departments would remind restaurants to adhere strictly to air exchange requirements and infection control measures. They should remind the diners to put their mask back on if they are not eating. Let's work together to prevent the fifth wave from happening. Cabinet Secretary.
Now, Hong Kong is the world's #1 air cargo center. Over the past period, we've been affected by the pandemic. But in 2020, our airport handled a total of 4.5 million tons of cargo, valued at some 3.5 trillion Hong Kong dollars. So the SL government in particular, the Transport and Housing Bureau, has been keeping in close liaison and communication with airliners. Now, earlier on, we made the requirement for aircrew members to stay at designated quarantine hotels for 3 days, and starting from tomorrow, we're going to extend that to 7 days. As we made these decisions, we have kept in close communication with airliners, and they've all expressed their willingness to comply fully with this requirement. Now, because of this latest requirement, of course, airliners will have to review their cargo flight schedules, and then they may have to bring in more aircrew members to take part in the closed-loop management arrangement, so that in their duty rosters, they will include the 7 days of stay at designated quarantine hotels. And because of that, they will have to suspend some of the cargo flights in the coming weeks. But then we have reminded them to take all necessary measures to increase their manpower and to deploy their manpower suitably. We have directed them to make sure that before the 7th of January, they must resume all the cargo flights and make sure that these flights could meet the air cargo demands of the community. And during this period, the THB would keep in close communication with all the relevant airliners. And then for other airliners, they could also give assistance so that we could minimize the impact during the short period ahead. And then we also want to see more aircrew members taking part in these duties and join the closed loop arrangement. And then at the same time, they're able to comply with the 7 days of a designated quarantine hotel stay. And together they could work to keep the diseases out of Hong Kong. Well, let's take an English question.
Okay. Is there a need to send people who visited the restaurants in Festival Walk or Central into quarantine visited by the confirmed cases as a precautionary measure, given that the virus managed to spread 10 meters across the Moon Palace and infected another diner? And question number 2, Professor Chan you said that the government will introduce a vaccine passport before the Chinese New Year. Can you explain why the requirement is only 1 dose of vaccine instead of 2? And is there an exact date when this policy will be implemented? And my third question is on the quarantine arrangement for cargo crew. Why is the government extending the quarantine period just a few days after requiring cargo crew to 3 days of quarantine in hotel? And have you considered the impact on the cost as well as the cargo flow to Hong Kong when you extended it to 7 days? Thank you.
Would Dr. Choi answer questions on the restaurant first, and then Professor Chan on the vaccine bubble, and Ms. Chan on cargo flights?
Okay. So for the investigations of the restaurant's infection case, we consider that this is a short-range airborne transmission so far as we collected information from our investigation details. So we consider that during the lunch period, which is about 200 patrons at this time, they are considered as close contacts to the infected case at that time. So for the management of a close contact, we have to quarantine the close contacts to the quarantine facilities for durations of 21 days after the last contact, so that we have to make sure they will not be infected to other peoples. So at present, we are, as reported by Dr. Zhong, at present we are contacting the patrons with the telephone number we got in hand, and we are trying also to receive calls from anyone who has patronized the restaurants at that time. Yes. And at present, we have already contacted about 80 patrons at that time, and we already sent them to the quarantine facilities. So, we do appreciate the cooperations of all the patrons at this time, because this is around New Year time. So secondly, for the staff working in the restaurant, we have sent about 22 staff to the quarantine facilities at that time.
Professor Chan, please.
Okay, as far as a vaccine bubble is concerned, I think as the government has introduced a vaccine bubble, I think since 6 months ago, when we first resumed many of our social distancing measures, especially those catering places or scheduled premises, those are that is high risk. The government is progressively expanding these vaccine bubble to more places now, and so our current plan, as our vaccination rate in Hong Kong, while it is overall it is over 70% now, but if we look at the elderly population, especially those who are over 80 years, is only about 20%, which is very low. For those who are above 70 years old, is not even hit 50%. So we think it is important for us to further promote and boost, vaccination, especially among these vulnerable groups in the context of Omicron and also the severe situation, especially globally. And now locally, we have found these local transmission in one of the restaurants. While we will continue to monitor the situation, to do risk assessment, and to exercise and implement the most stringent measures. But it is also important for the public to protect themselves by vaccination. So we are not saying that one dose of vaccination is enough, but we also have to be practical while we want to implement, this measure, vaccine bubble, for all the scheduled premises under Cap 599 as soon as possible. And why before Chinese New Year? Because we understand, during the holiday, people will be gathering, people will be, coming together. So it is important for them to protect themselves as soon as possible.
Ms. Chen, please.
In view of the increasing imported Omicron cases, the government decided today to further tighten the quarantine arrangements for locally based air crew. With effect from 00 hours on the January 1st, 2022, all locally based air cargo crew who have laid over at overseas places or Taiwan will be required to stay in designated quarantine hotels for 7 days until obtaining negative tests. After leaving the designated quarantine hotels, they will remain subject to multiple tests for COVID-19 regularly during their medical surveillance periods in order to monitor their public health situation on a continued basis. The above measure should further help safeguard public health, but will have impact on the air cargo services in Hong Kong. We all know that despite the ongoing pandemic situation, the Hong Kong air cargo services play a very important role to the Hong Kong community in providing transport of all the necessities and the basic requirements to the Hong Kong people during the period. We have been communicating closely with all airlines and communicated with them on all the necessary pandemic prevention conditions. As regards the coming manpower deployment, we have already invited and asked the airlines to require and schedule more air crew to participate in closed-loop operation in order to reinforce the manpower deployment to meet the air cargo demand. We would also engage other airlines to help supplement any loss in the capacity in the coming periods. So all in all, the government appealed to the local-based air crew members to support the government in fighting against the pandemic situation and in contributing to maintain the air cargo services in Hong Kong.
最後兩條，嗰邊第四行白色
Two last questions. The lady over there.
MP, so we would just like to double check with Professor Chan that whether, did you mention that there are 4 Cathay Pacific staff reached the route? So who is the 4th person? And as the aircrew only breached their internal rules, and so will they face any legal consequence? And did they provide any false information to the authorities? Will they be prosecuted? And second, what is the genome sequencing result of the patient? Could it determine whether the aircrew members caught the virus in the US or from each other over the lunch, and whether the patrons caught the virus from the aircrew member in the restaurant? And third, the Live Home Safe app is only notification based only. So what would the government do if some residents do not turn up to the testing centers? Thank you.
Will Professor Chen please answer questions 1 and 3, and then Dr. Chuan answer questions 2 on genomic sequencing.
Okay, thank you for your question. I think yes, there are 4 pilots that have violated the rules. And I think the 4th one is the one that I think Dr. Cheung has mentioned, the one that actually during this 3-day, isolation, home isolation, has went to bars and or other places because they are supposed not to leave home unless it is really, really essential, such as going for testing. So I think that's the situation. As far as the legal consequences is concerned, I think according to our CAP 599 rules on medical surveillance, that is requiring them to self-isolate after they return to Hong Kong and also do medical surveillance. If they have violated such requirements, then the penalty is $5,000 or going to jail for 6 months. I think these are the penalty. As far as Leave Home Safe is concerned, yes, the Leave Home Safe would provide will give notification to people for testing. And as we understand, from some of the statistics provided to us recently in the last few days, as for the number of people getting tested in the community testing center. So for the last few days, is over 20,000. People have gone to the testing center to get a PCR test, and that is, one of the highest, among the normal sort of daily testing situation. So I think we believe that people are following, the rules. But of course, we will appeal and also remind people, as Dr. Choi just now have highlighted, some of the places that while the through contact tracing, we have identified different places. And so for people who, first of all, we want to appeal to people to be very, very vigilant about their own sort of daily activities and also mask wearing. And secondly, also be aware of, go to our website or be aware of the notices that the government is sending out so that they know that whether they are one of the people who require compulsory testing or not. But then we will monitor the situation.
Dr. Tran, please.
Yes. Indeed, you're correct that the whole genome sequencing can help to differentiate whether the cases acquired infection over abroad or locally in Hong Kong. So, so far we have conducted whole genome sequencing for 3 cases, and the other cases are being conducted. So for the whole genome sequencing for 12609 and 12611, who had lunch together, and their whole genome sequencing result is identical. So it's likely that 12609 and 12611 are related. So it is possible that 12611 acquired infection from 12609, who had earlier infection, because they came from different places of the United States. 12609 came from New York, and 12611 came from Chicago. So if they have identical gene sequencing, it's likely that they are related. The 12610 has is a bit different from the 2 other cases. So he's not related to these 2 cases. For 12649, his gene sequencing is being conducted. And for also the 2 other cases, 12637 and 12654, related to the moon palace, we have to do the whole genome sequencing to confirm the association with 12611.
As far as the details of the activities of these crew or pilot, I think the Center for Health Protection, when they are doing contact tracing, they will, gather all these information, from them. And as I've said earlier, according to the CAP 599 regulation on medical surveillance, requiring medical surveillance and home isolation, then they will be penalized if they violate such regulation.
好，最後一條
The last question.
色衫第三。
On the third row, the lady in blue. I'm from the Hong Kong Economic Journal. 2 questions. First one. Now, for the elderly aged 70 or 80, there's a low vaccination rate. Now, these elderly people have been thinking about it for a long time, probably because they have no confidence in the vaccine. Now, in less than a month, you ask them to take the vaccine or they will not be able to go to restaurants. So are you giving people the impression that you're forcing them to take the jab, and would 1 month be too short a period? Now, for the Moon Palace case, can I ask Dr. Chuang for some information? The 2 diners were 10 meters apart. How many tables were they apart? Now, 200 customers have to be sent to quarantine. So have you assessed the risk? Is it the case that the risk is really high? Why did you come to such a decision? Just now, and now there are preliminary positive cases involving this group. Someone asked about that, but you didn't answer the question. First, Professor, please. On the vaccine bubble, there is only one of the means for us to boost the vaccination rate. Well, you may have noticed that we have been making it easy as far as possible for people to be vaccinated, especially for the elderly living in elderly homes or in the community. We try to make it as easy as possible for them to take the vaccine, and then we have seen a boost in the vaccination rate. We've even organized large-scale talks or small-scale talks to explain to the elderly the importance of the vaccination and also to answer their queries. Now, I've been to quite a number of such occasions, encourage the elderly to take the vaccine. So at these talks or in other activities, that the public, the elderly may be encouraged to take the jab, but then perhaps that's not moving quickly enough, or we're not getting enough old people to take the jab, and some may still remain skeptical. That's why our initial proposal is to expand the scope of the vaccine bubble, and there are 2 considerations. The first one is about your question. You asked whether we're allowing too little time for people to get the vaccine, but actually at the community vaccination centers, at private doctors, there aren't that many people taking the vaccines here. In other words, there is still a huge capacity for the public to take the vaccine, and if there are many people want to take the vaccine, the government will make sure that they could do so within a short period of time, and that's what we would like to see, really. Your second point about the timeline. Now, what is considered a long or a short period, really? Omicron is coming on fast and is a major threat. And then in the community, we've actually seen transmission. So this is really the best time for people to take the jab as soon as possible. So people have to get vaccinated as soon as possible. Dr. Chuang, that diner was seated close to the wall. And for case 12611 and the family member, they were seated close to the door. So they were a corridor apart and also a layer of tables apart. So it's not like they were seated next to each other. And so that's not how it was transmitted. And then together with the MSD colleagues, we have done tests at the venue. We learned that air exchange was a bit poorer in that particular location, it's been near the table of close to the wall. So it could be a super spreader case. That's our suspicion. That's why we don't want to leave out any possible infected cases. So we ask for the understanding, the public will ask for the cooperation. Thank you. So that's the end of the press conference. Thank you. Sorry, the speaker is not using a microphone. Sorry, the speaker is not using a microphone. Sorry, the speaker is not using a microphone. Well, for each of the confirmed cases, they've been to many restaurants, so it's impossible to close all the restaurants. For the Moon Palace, because there is this particular infection cases, that's why it's more serious. As for other restaurants, we'll try to track the diners and the staff members, and we'll remind them to take the test. And then these restaurants will also be doing sanitization. Thank you.